Hi there, I'm Dr. Benj. I'm one of the GPs at Trinity Court Surgery, and today we are going to talk a little bit about the PSA test. So it's quite a hot topic, and lots of men might be interested in having a PSA test because they're worried about prostate cancer. So PSA stands for prostate specific antigen, and it's measured by a blood test. Any man over the age of 50 can ask the GP for a PSA test, but it isn't routinely offered. We tend not to test in men under 50 because the chances of prostate cancer under 50 is very rare, and all the research to date has pretty much been done on men over 50. So this is why we have those guidelines, and all the data that we have about PSA levels is done after the age of 50. So you can ask for a blood test and you can discuss why you might want one. You might be offered a PSA test if you have symptoms of prostate problems. So that can be difficulty passing urine with a poor stream, or needing to go more frequently, or needing to go urgently, or getting up more in the night to go, or sometimes if you find that you dribble on a little bit at the end. Other signs where we would want you to contact us to discuss, and you might have a PSA test as part of your workup, could be if you've got blood in your urine, or if you're finding it difficult to get or maintain an erection. So if you go ahead and have a PSA test, in terms of preparation, like I said, it's a blood test, so you'd be asked to book for a blood test. And then in the 48 hours beforehand, we would advise that you don't have sexual intercourse, don't ejaculate, and don't do any vigorous, strenuous activity that leaves you out of breath for the 48 hours beforehand, because this can artificially raise your PSA. The PSA isn't 100%, so it is possible to have a high PSA level, and that would probably lead to further investigations, which can be a little bit invasive, and that might be unnecessary. So there is a risk that you get a high PSA with actually no prostate problems at all. It also isn't necessarily an indication of cancer, so you might have a raised PSA test if you've got an enlarged prostate, and the risk of that happening as you age increases. That can be a completely benign enlargement that can still give you symptoms and a raised PSA level. So it's worth understanding that a raised PSA doesn't necessarily mean cancer and might lead to further investigations anyway. It is also possible to get a false negative result, so you might have a normal PSA level even in the presence of prostate cancer. So this isn't 100% specific or sensitive for prostate cancer. Once you've had the test, we usually get the results in about 1 to 2 weeks, and then we would let you know. We tend to file the results as normal, and you can see these on your NHS app. If there is anything raised, we may want to repeat it, and if you have a further raised sample, then it may be that we want to refer you on for further investigations, but we would discuss that with you at the time. I hope that helps and helps you make a decision about whether you want to go ahead with a PSA level. If you do, then, like I said, you can have a discussion with a doctor or book in for a blood test and fill in an e-consult in the usual way.